Hello everyone, welcome back to Study with Amzad with a new video. First question. A patient present with a suspected ischemic stroke. Which diagnostic test is the priority to rule out a hemorrhagic shock before administering TPA? Option A. MRI of the brain. Option B. Non-contrast CT scan of the head. Option C. Lumbar puncture. Option D. Electroencephalogram EEG. Next question. While assessing a patient with a chest tube, the nurse notes tidling fluctuation in the water seal chamber during inspiration and expiration. What is the nurse's best action? Look at the option. Option A. Notify the physician of the potential air leak. Option B. Check the tubing for kinked or loops. Option C. Document this as a normal expected findings. Option D. Increase the suction pressure immediately. Next question. A patient is diagnosed with Addison disease. Which of the following skin changes should the nurse expect to observe? Option A. Extreme pallor. Option B. Hyperpigmentation. Option C. Ruddy purple stria. Option D. Jaundice. Question number 4. A nurse is caring for a patient after a craniotomy. To prevent an increase in intracranial pressure, the nurse should maintain the patient head in which position? Option A. Flat 0 degree. Option B. A Trendelenburg position. Option C. Midline with head of bed elevated 30 to 45 degree. Option D. Lateral Sims position. Next question. Which of the following is an early sign of compartment syndrome in a patient with a lower leg fracture and a cast? Option A. Absence of pedal pulse. Option B. Paresthesia. Option C. Cold cyanotic toes. Option D. Paralysis of the limb. Question number 6. For a patient with chronic obstructive pulmonary disease (COPD), the nurse should ensure that oxygen is administered at a low flow rate, primarily to avoid option A. Oxygen toxicity, option B. Rupture of emphysematous bullae, option C. Suppression of the hypotoxic drive to breathe, option D. Excessive drying of the nasal mucus. Question number 7. A pregnant woman at 36 weeks gestation is diagnosed with placenta previa. The nurse must prioritize monitoring for which of the following? Option A. Severe abdominal pain and rigidity. Option B. Painless, bright red vaginal bleeding. Option C. High blood pressure and protein in the urine. Option D. Early declaration on the fetal monitoring. Next question, question number 8. Which medication is the antidote for magnesium sulfate (MgSO4) toxicity in a preeclamptic patient? Option A. Naloxone. Option B. Vitamin K. Option C. Calcium gluconate. Option D. Protamine sulfate. Next question. A newborn is being assessed at 1 minute after birth. The heart rate is 110 beats per minute. There is a slow, irregular respiratory effort, some flexion of extremities. The baby grimaces when suctioned, and the baby is pink with blue extremities. What is the AUGA score? Option A 5, option B 6, option C 7, option D 8. Now look at question number 10. At what age does a child typically start to walk independently and speak 2 to 3 simple words? Option A 6 months, option B 9 months, option C 12 months, option D 18 months. Next question. Which cranial nerve is responsible for the movement of the tongue during speech and swallowing? Option A cranial nerve 9, option B cranial nerve 10, option C cranial nerve 11, option D cranial nerve 12. Next question. During the administration of a cleansing enema, the patient complains of abdominal cramping. The nurse should option A stop the procedure immediately, option B lower the enema bag to slow the flow, option C increase the height of the bag to finish faster, option D instruct the patient to hold their breath. Next question. Which heart valve prevents the backflow of blood flow the left ventricle into the left atrium? Option A tricuspid valve, option B pulmonary valve, option C mitral valve, option C aortic valve. Next question. Question number 14. What is the correct ratio of chest compression to ventilation for an adult during 2 rescuer CPR? Option A 15 is to 2, option B 30 is to 2, option C 5 is to 1, option D 30 is to 1. A nurse is preparing to administer digoxin. The nurse must withhold the medication and notify the providers if the apical pulse is option A below 60 beats per minute, option B below 80 beats per minute, option C above 100 beats per minute, option D regular and strong. Question number 16. The Agartala Government Medical College AGMC was established in which year? Option A 2002, option B 2005, option C 2008, option D 2010. Next question. Which river is known as the longest river in the state of Tripura? Option A Howrah, option B Mono, option C Gumati, option D Khowai. Question number 18. If the cost of 5 nursing textbook is 2500, what is the cost of 12 such textbooks? Option A 5500, option B 6000, option C 6500, option D 7000. Next question. Choose the odd one out among the following medical specialty. Option A cardiology, option B nephrology, option C dermatology, option D pathology. Next question. The Ayushman Bharat PMJY scheme provides a health cover of how much per family per year? Option A 2 lakhs, option B 3 lakhs, option C 5 lakhs, option D 10 lakhs. Next question. A patient repeatedly washes their hands 30 times a day to keep the germs away. This behavior is an example of option A an obsession, option B a compulsion, option C a delusion, option D a phobia. Question number 22. Which level of prevention is represented by screening for breast cancer using mammography? Option A primordial prevention, option B primary prevention, option C secondary prevention, option D tertiary prevention. Next question. The cold chain system in immunization is used to maintain the potency of vaccination. Which vaccine is most sensitivity to heat? Option A BCG, option B DPT, option C OPV, option D TT. Next question. In biomedical waste management, human anatomical waste, like a placenta or amputated limb, should be discarded in which color bag? Option A red bag, option B yellow, option C blue, option D black. Question number 25th. A patient with schizophrenia tells the nurse, the TB is sending me special coded message meant only for me. This is called a option A hallucination, option B delusion of reference, option C delusion of grandeur, option D illusion. Question number 26. A patient is prescribed lithium carbonate for bipolar disorder. The nurse should instruct the patient to maintain a consistent intake of which of the following? Option A potassium, option B sodium, option C calcium, option D magnesium. Next question. A client with schizophrenia says, the world is ending today because the sky is falling. This is an example of option A looseness of association, option B neologism, option C delusion, option D word salad. Question number 28. Which of the following is the most common side effect of electroconvulsive therapy? Option A permanent brain damage, option B long term personality changes, option C temporary memory loss and confusion, option D fractures of the long bones. Question number 29. A patient with alcohol withdrawal is experiencing tremors, agitation, and hallucination. Which medication is the drug of choice to manage these symptoms? Option A disulfiram, option B methadone, option C chlordiazepoxide, option D naloxone. Question number 30. The nurse is caring for a patient with anorexia nervosa. What is the priority nursing intervention? Option A exploring the patient's feelings about body image, option B supervised weighting and monitoring of nutritional intake, option C teaching the patient about healthy cooking, option D initiating group therapy session. Next question. A 2-year-old child is admitted with working cough and inspiratory stridor. The nurse suspects croup. What is the primary nursing goal? Option A administering broad spectrum antibiotic, option B maintaining a patent airway and reducing respiratory distress, option C forcing oral fluids to thin secretions, option D keeping the child in a supine position. Next question. In a child with tetralogy of Fallot, which position should the nurse place the child in during a TET spell? Option A high phallus position, option B knee chest position, option C left lateral position, option D Tenderloin bird position. Next question. Which of the following is a classic sign of pyloric stenosis in an infant? Option A current jelly stool, option B projectile vomiting after feeding, option C bile stained vomitus, option D abdominal distension and constipation. Question number 34. A child is diagnosed with nephrotic syndrome. The nurse should expect to see which clinical manifestation? Option A gross hematuria and hypertension. Option B, generalized edema and proteinuria. Option C, weight loss and increased activity. Option D, hypotension and polyuria. Choose your correct answer. Next question. Phototherapy is used to treat neonatal jaundice. Which of the following is a critical nursing responsibility during this procedure? Option A, checking the baby's temperature every 8 hours. Option B, keeping the baby's eyes and genitals covered. Option C, restricting fluid intake to prevent diarrhea. Option D, dressing the baby in a full sleep one side. Next question. A nurse is preparing to insert an esophageal tube. How should the nurse measure the length of the tube to be inserted? Option A, from the tip of the nose to the earlobe to the xiphoid process. Option B, from the bridge of the nose to the umbilicus. Option C, from the forehead to the xiphoid process. Option D, from the mouth to the stomach. Next question. Which of the following is the most accurate method to confirm the placement of a newly inserted NG tube? Option A, aspirating gastric contents. Option B, air insufflation and auscultation over the epigastrium. Option C, X-ray of the chest and abdomen. Option D, checking the pH of the aspired fluid. We'll see next question. When performing a surgical hand scrub, the nurse should keep their hand. Option A, below the level of the elbows. Option B, at the level of the wrist. Option C, above the level of the elbows. Option D, in a relaxed downward position. Next, question number 39. A patient is receiving a continuous IV infusion of heparin. Which laboratory value should the nurse monitor to evaluate the effectiveness of the therapy? Option A, PT. Option B, INR. Option C, APTT. Option D, bleeding time. Question number 40. The nurse notes a stage 2 pressure ulcer on a patient sacrum. How is this stage characterized? Option A, non-blanchable erythema of intact skin. Option B, full thickness skin loss with visible subcutaneous fat. Option C, partial thickness skin loss involve the epidermis or dermis. Option D, full thickness tissue loss with exposed bone or muscle. Next question. The World Health Day is celebrated every year on option A, April 7th, option B, May 12th, option C, June 5th, option D, December 1st. Question number 42. Which of the following is the most common cause of maternal mortality in India? Option A, sepsis. Option B, obstructed labor. Option C, obstetric hemorrhage. Option D, anemia. Question number 43. Under the National Immunization Schedule, at what age is the first dose of measles rubella MR vaccine administered? Option A, at birth. Option B, 6 weeks. Option C, 9 completed months. Option D, 15 months. Question number 44. ASHA works primarily at which level of healthcare system? Option A, district hospital level. Option B, community health center level. Option C, village community level. Option D, sub-center level. Question number 45. Which index is used to measure the intensity of infection with hookworm in a community? Option A, Pearl index. Option B, Chandler's index. Option C, Quetelet's index. Option D, ponderal index. Next question. Who is the current health minister of Tripura as of 2026? Option A, Dr. Manik Shah. Option B, Sri Ratanlal Nath. Option C, Sri Sushanta Chaudhary. Option D, Sri Shantana Chakma. Question number 47. Unakoti, a famous historical and heritage site known for its rock cut carving. It located in which district of Tripura? Option A, West Tripura. Option B, North Tripura. Option C, Unakoti district. Option C, South Tripura. Next question. In a certain code, nurse is written as QXUPH. How would hard be written in that code? Next question. A train travels at a speed of 60 km per hour. How much distance will it cover in 15 minutes? Option A, 10 km. Option B, 15 km. Option C, 20 km. Option D, 25 km. Question number 50. Which vitamin is primarily synthesized in the human body when exposed to sunlight? Option A, vitamin A. Option B, vitamin B12. Option C, vitamin C. Option D, vitamin D. So here is your all answers at the end. Check your all answer here, how many you got correct in this mock test, and comment below your score. Thanks for watching this video. Like, share and subscribe to our channel and press the bell icon for next videos. Thank you everyone. And don't forget to comment your score in the comment box.